While people keep introducing themselves, I'll go ahead and introduce the webinar today. Today, we're going to hear from young professionals in global and public health and hear stories from them about when they were starting out and what led them to where they are right now. I'm Carolyn O'Brien, and I'll be moderating the session today, and we have 3 panelists with us to share their experiences. If you're new to Christian Connections for International Health, we're an international network association of about 130 members and 130 organizational members and over a few hundred individual members. CCIH's mission is to promote health and wholeness from a Christian perspective and provide opportunities for capacity building, networking, and shared best practices in advocacy. So for the webinar today, I'll explain our 3 panelists and give a little bit of their bio and background. And then we'll open up with a few questions for all of our panelists and then open up to Q&A from all the attendees. So hope you came prepared with questions and we should have a great session today. This webinar will be recorded and will be sent out. A link will be sent after the session has been completed and the webinar has been posted onto CCIH's YouTube channel. You can also find it on CCIH's website under Resources, Faith-Based Global Health. So without further ado, I'll introduce myself. I am a project coordinator at CCIH. I've been at CCIH for almost a year, and my main responsibilities are managing our USAID funded grants, and those are mostly focused in maternal child health and family planning. My background is in international health, health systems. I've had great experiences practicing and researching global health in Peru, Malaysia, and most recently with the Peace Corps as a health educator in Albania. I got my MSPH from Johns Hopkins Bloomberg School of Public Health and my BA from Clemson University. Our first panelist with us today is Zana Kiragu. Zana is a Kenyan pharmacist and public health professional. She is currently a research fellow in the Department of Global Health at Boston University School of Public Health. She volunteered at CCIH 2019 conference while pursuing an MPH at Johns Hopkins Bloomberg School of Public Health. Received her bachelor's and master of pharmacy at the University of Manchester in 2015 and practiced in industrial, clinical, and retail settings in both the UK and Kenya. Zana currently sits on the CCIH board of directors, and we're grateful for her participation. Our next panelist is Kaity Hauter. Kaity currently works with the Virginia Department of Health in viral hepatitis prevention. She holds a master's degree in public health from George Washington University and a bachelor's degree in law, liberty, and justice from Clemson University. She served in the Peace Corps in Ukraine as an English teacher. It was during her Peace Corps service where she was first exposed to public health as she worked alongside her Ukrainian colleagues to develop HIV prevention activities and educational materials. Kaity is a CCIH member and was a CCIH intern in 2018. And our final panelist is Brian Blonder. Brian is an international development professional with a strong interest in the intersections of health, food security, and climate change. He is currently a business development associate at Chorus International, where he works to find new funding opportunities for the company and supports the development of institutional donor proposals. He has been a member of the business development team at Chorus and IMA World Health, one of Chorus's founding members, since 2018. He holds a BA in International Studies from American University, and he's currently based in Washington, D.C. So without further ado, I'd like to invite our panelists to turn their cameras on, and we can open with a broader question, so you can take a second to kind of explain more about your personal interests and your current work. What helped shape your path and launch your interest in the field of global health or public health? And let's start with Zana.
Sure. Thank you, Carolyn, for that introduction. And good morning, good afternoon, everyone. Lovely to be here today. So I my path in my interest in global health was inspired by my exposure to two different health systems. As Carolyn mentioned, I am Kenyan and I received my pharmacy training in the United Kingdom. So I was exposed to pharmacy practice in both the UK and Kenya. For instance, in my hospital pharmacy experience in the United Kingdom, I was primarily ward-based in an NHS hospital, and where the focus was on my clinical training and building on that, and the focus was on undertaking ward rounds and being part of this multidisciplinary team alongside doctors and nurses. And in Kenya, when I had my hospital pharmacy experience, I was primarily dispensary based, where the focus was more on brand recognition and still focused on clinical pharmacy, but a little bit removed from that multidisciplinary approach, working as closely with doctors and nurses. So this made me interested about the context within which pharmacy practice was undertaken, and I wanted to learn more about the broader health system within which pharmacy sits. And that's where my interest in public health was born, and in global health specifically. So, and that led me to pursue a master's of public health at Johns Hopkins.
Thanks, Zana. Kaity, do you want to answer next?
Yes. My Peace Corps service is what shaped my interest in public health. As my bio said, I went to the Peace Corps as an English teacher for primary and secondary school. But as a whole country, all the Peace Corps volunteers had the opportunity to work in HIV education and work closely with our school and our colleagues to develop new curriculum and materials that could be used in our regions. And it was there that I started asking questions about, well, we have these education materials, but how does someone receive treatment or prevention? How does someone access the healthcare system? And then at the community level, what can we do as schools and businesses and other community partners to leave lasting impact on our students and our young people and all of our families. So when I came back from the United States is when I pursued a master's of public health.
Thanks, Kaity. As another RPCV, I'm happy to see your representation in getting into the public health world. Brian, over to you.
Sure. Thank you, Carolyn. So I got into the field of global health and the wider field of international development because of my desire to help people and have an impact. A lot of people here, I just wasn't really sure how to do that. When I graduated from college, I didn't have a job, and I began temping through a temp agency. And my last job was actually with my current job. And through that temp experience, I got to learn more about what my company was doing and the wider field of international development and global health. And it really got me interested, and I'm happy to still be there and learning every day.
Thanks, Brian. So our next, I know that we talked about, and in our advertisement for the webinar, we talked about, how are we integrating faith and work? And we would love to hear from the panelists how your faith inspires what you do. We know that, from your bios, not all of you work for faith-based orgs, and we would be interested to hear how you integrate faith in what you do and how it inspires you. Who would like to start? You can go ahead, Zana. Thanks.
Sure. I decided let's keep the trend going.
Yeah, that sounds good.
Yes. So as you mentioned from my bio, I do not work for a faith-based organization, and until most recently when I joined the CCIH board, and I am also supporting CCIH with one of their health system strengthening project, I didn't really have any exposure to the church health system and global health in the faith-based space. My work has largely been focused on pharmacy practice, as I introduced, and currently I am in academia working on access to medicines research, which builds on my pharmacy practice, and also doing a part-time doctoral program. So the influence that my faith has had on my work is more at a personal level. So on one hand, there's this aspect of doing everything that you do as for God and not for man. So I've taken my work as a form of prayer, and since I'm engaging my capabilities, my gifts, and my resources to contribute to the world, to add value to whichever space I am in. And at another level, which is more specific to global health, is one of the main things that drove my interest in global health and public health was not only the differences in how pharmacy was practiced in Kenya and the UK, but also the differences in disparities, and thinking about disparities in access to care and access to medicine. So for example, when I was working as a retail pharmacist at an upscale mall in Nairobi, patients very easily walked in and got their weekly, monthly refills of their antihypertensive medicines or anti-diabetic medicines. And on the other hand, when I was doing my MPH, I did my field work in Kenya, and I was in Milo, which is a town in Bungoma County, where the cost of traveling to a clinic to get medicines was a challenge. So there's this huge gap and differences based on your socioeconomic status, and there's a lack of preservation of human dignity in the way that our world today is ordered, and that needs to change. So the systems do need to change, which is why I entered the field of global health. I do believe that global health as a field attempts to address those disparities. The question as to whether we are moving that needle as quickly as it could be moved is a whole other discussion, but I remain hopeful. So that's how my faith inspires my work.
Thanks so much, Zana. Kaity, do you want to respond?
Yes, I also do not work for a faith-based organization. I work for a state government, which has been fascinating because prior to coming to the state government, I was in graduate school and I was the CCIH intern. And I also worked for my local church while I was in graduate school as well. So I was surrounded by a few different faith-based organizations, and then to shift to a secular organization. So my faith is also at a personal level, and absolutely informs my work. The projects that I work on are for viral hepatitis and HIV, in a division that structures funding for people without insurance who are underinsured in order to get access to testing for diseases that are most usually concentrated in populations that have low employment, low access to healthcare, often rurally based, have had multi-generational impacts of the same lack of access to jobs and good schools and medicines and a reliable health system. It really is serving the least of these in my state. So I can really, even being in a secular environment, see the Lord's hand at work. And so being a Christian, even in a secular environment, is a blessing.
Thanks, Kaity. Go ahead, Brian.
Sure. So like Zana and Kaity, my faith also impacts my decisions and my daily work at a personal level. So I do work actually at a faith-based organization, but it is a different faith than my own. So I'm Jewish, and in Judaism, there's a concept called tikkun olam, which translates to heal or repair the world. And it's at the core of Jewish teaching about social responsibility and social action. From an early age, this concept has had a deep impact on me and my decisions, and it's guided my career path and guided me to pursue a career that puts helping others and the greater good at its center. And that personal belief aligns very closely with the beliefs and practices of my organization. So I'm lucky that I'm able to put my faith to work every day.
Thanks so much, Brian. I'm personally feeling motivated by you guys right now, explaining how your faith has really drives your work in all different ways, and creates an opportunity for you all to become change agents in the various sectors of public health. So thanks so much for sharing that. Our next question is about the field and how things change and how you have changed and your interests have changed. This question might be helpful for current students in undergrad or grad school, but we want to know how, if you knew what you wanted to do in college or grad school, or how your career path pivoted post-college or grad school. Over to you, Zana.
Sure. Thanks, Carolyn. So I did not know when I was doing my pharmacy program, I wasn't sure what that would, I wasn't sure what my next steps would be. I know I was studying to become a pharmacist. I can't say that I went in with this passion and fire to be a pharmacist. That was not my dream as I grew up. I just knew that I enjoyed working with people and I liked science and I was good at science. So this degree made sense. And I really enjoyed it. I enjoyed my program, and the fact that I was training in a health system that was foreign to my own is what brought in this awareness of public health and global health, as I described earlier. And it took me some time, to be honest, to understand what that meant after I graduated, because I was now a pharmacist, qualified in the UK and in Kenya, and I'm now venturing into this public health world through my MPH. I was the only pharmacist in my MPH class of about 200 people. So there were dentists, doctors, nurses, and people from various humanities backgrounds and public health majors, but no pharmacists. So I felt a little bit isolated and unclear on how to bridge my two worlds, my pharmacy training and the public health training. But now, as the more I learn about global health and the more exposure that I get, as I mentioned, I'm working on access to medicines research. I feel that I'm slowly finding how to link the two worlds together, because I'm focused on health systems issue, which is medicines, one of the six pillars of one of the six building blocks of the health system. And I am thinking about, and that's my pharmacy training. I learned all about medicines and thinking about how to get them to people who need them and how to get them to vulnerable populations. So it definitely at the time felt like a major pivot when I went from pharmacy to public health. But the more I grow in this work that I'm doing, the more I realize that I'm building onto my pharmacy foundation rather than starting afresh in this global health world.
Thanks so much, Zana. Kaity, over to you.
Similar to Zana, I have also had an evolving story that has built on itself. Instead of coming from the sciences background, I was in the humanities when I was an undergraduate. I was in the, I actually was studying philosophy and specializing in law, liberty, and justice. And I had always had a draw towards justice studies and humanitarian work. I didn't know what that looked like per se, other than I kind of had an inkling that, and some cursory overview of what those subjects look like from late in high school. So as I moved down that path in undergraduate, and then at the end of my undergraduate studies, just like everyone needing to find a job, decide what's next, I came across the Peace Corps opportunity and then was accepted. And I had known from the time I was late in high school that I wanted to live in another country by the time I had finished undergraduate studies. So I followed that opportunity as still in the humanities and working as a teacher. And it was from that angle that when I came into contact with public health, and really I started teaching on HIV, and then kind of wondered, well, I wonder if there is a career in this. and learned that that's called public health after that. So the short answer is I did not know when I was 18 or even 22 exactly what I wanted my career to look like. And then even as I started graduate school, I came to understand I'd had a glimpse of public health in the field. And then in graduate school, just saw how broad the opportunities were in all of the different areas that you could go. So even now as a professional, I'm learning that as well. I took a role in viral hepatitis, and that has branched into working in HIV work. And so the opportunities keep growing, and you'll have a lot of different avenues to explore interests in this very broad field.
Thanks so much, Katie. I think that is a common experience among many people just starting out in public health. You kind of have an idea of what you'd really like to do and then realize, wait, that's public health. Okay, now we can go forward. And so it's nice to hear from other people who've had similar experiences. Would you like to respond, Brian?
Sure. So similar to my other panelists, I also thought I knew exactly what I wanted to do when I was in college, and then everything took a bit of a turn. So I went to undergrad thinking that I would want to do international relations with a focus on national security. All of the classes that I took in college were national security courses. My school offered development and global health courses. I didn't end up taking any. In hindsight, I wish I had. But so I graduated with a degree in international relations with that focus in national security. But by the time I graduated, I was less certain that that was what I wanted to do. And it wasn't really until I got to my current job that I was certain and firm in my belief that I did want to actually focus on international development. But the skills that I had learned in undergrad made the transition a little easier, because while it was a completely new subject area for me, the research, the writing, the communication, the analysis, those core skills that I had learned and developed in undergrad really helped make that transition smooth. And just to echo what Katie had said, you're not necessarily going to know what you want to do while you're an undergrad, and it's really not realistic to expect college students to know what they want to do before they've had a chance to be in a real job in the real world. So I also want to echo that.
Thanks so much, Brian. I would love to open it now to all of the attendees to submit your questions using the Q&A box. We'll try to answer as many as we can, so feel free to start submitting your questions. And while you're doing that, we will jump to another question, but please continue to submit your questions while we do that. So our next question for panelists are, what is something that you would have liked to know just starting out as a young professional? Looking back, is there something that, you know, if I had known this before, this would have really helped me? And so, Zana, if you have something, you can start out, but if not, we can start with one of the other two as well. You tend to get the first go at all the questions, so.
Does somebody else want to jump in?
I'm happy to hop in real fast. So there are two things that I really would have liked to have known starting out, and I sort of echoed them in my previous question. The first one is come in to everything with an open mind. What you focused on in college may not be what you end up working in and being interested in, and that's okay. There is no right way to do life, do jobs. Everyone has a different path. So just go for it and be open to change. And also know that sometimes knowing how to do something is more important than some of the book knowledge that you may have. And you never know where your skills could lead you.
Thanks, Brian. Katie?
Happy to answer.
Thanks.
Echoing a lot of what Brian said, in no position I've held so far, either before my master's studies and after my master's studies, has solid research and writing skills gone to waste. So the opportunities you have to develop those skills are will serve you well in your career. I would say also it's okay to say that you don't know exactly what you want to do, and that's what informational interviews are for. I did lots of informational interviews, which actually was a Peace Corps recommendation when I was coming back to the United States. Our Peace Corps post prepared us for re-entry into the United States, and they said, start asking people what they do and what it looks like and how they got there. And so I did that before my master's studies to narrow down where I wanted to study and what I wanted to study. And I did that again in graduate school. And I actually now, because of the job that I have realized I'm very interested in behavioral and mental health. And so I've started the informational interview process again. And anytime you meet someone that is related to a field that you are curious about, just say, may I talk to you for 15 to 20 minutes, or get a cup of coffee with you, or go for a walk, have a quick Zoom call. And just about everyone I have asked that question to has been happy to tell me their story.
Thanks so much, Kaity.
I would echo everything that Brian and Kaity have shared. I absolutely agree with staying open, because you just don't know how your life and your work will take a twist and a turn, and trusting the process and the value of your networks, which Kaity just touched on around informational interviews and speaking to people. People are always open and willing to share. So do not hesitate to invest in your networks and reach out to people and schedule a call, write that email. And one of my mentors advised me to keep a spreadsheet tab and have like tabs of people that I've met, say at conferences, or people I've been introduced to, and the value addition they have in my network, and then establish an appropriate amount of time that would be feasible to reach out to them, just to touch base, even if it's annually, just to keep people up to date, so that you're not losing touch with people, because you never know how your networks could support you especially as you're establishing and building your career.
Absolutely. Thanks so much. It's great. We see some questions coming in, so thanks so much for everyone who's sending in a question. The first question we have is, have you encountered any challenges being a Christian in public health? For example, I know working in HIV has a lot of intersection with LGBTQ population who may be uncomfortable interacting with a person of faith due to perceived judgment. I think that, Kaity, maybe we can start with you, because I know that you deal with this on a daily basis, but for all of the panelists, if you've experienced any challenges as working as a Christian in public health, or as a person of faith in public health. Thanks.
That's an excellent question. And if you pursue a career in public health, you will come across this. So yes, I encounter LGBTQ issues, a lot of transgender issues. I currently, a lot of my work involves injection drug use and supporting syringe exchanges. And I'm one of the few Christians in my office. It has not been a hindrance to my relationships with my coworkers or with the organizations that we support. And actually, we do have a clinic that we support that is a Christian clinic. And we fund them for HIV testing and HIV care. It has been a prompting to really investigate my faith further and prayerfully consider where I stand on a lot of hard issues, and to develop my eyes, I think of it as seeing the people who are accessing the services we offer as people with often very hard and painful stories, and learning how to relate to people with stories much different from mine, who have worldviews much different from mine. I have scripture on my desk. I try to make a practice of praying for the people that we support daily at my office, and praying for my coworkers. But my coworkers do know me as a Christian. It's not something that I hide when I'm at work.
Thanks so much, Katie. Just adding, when I was in undergrad, I also had an internship working at a syringe exchange project. And I just tried to remind, when these questions or these conflicts would come up, I would try to remind myself and whoever I was having the conversations with, what would Jesus be doing if he was around? Where did he spend his time? He spent his time with outcasts of society, people needing help. And so what should we be doing now? And where would we see him if he was here today? And so that question always brought up a lot of conversation. And, it can be tricky sometimes navigating from both sides, from Christians who are like, why are you doing this type of work? And from non-believers saying, why aren't you doing this? Or why are you doing this? And so just kind of focusing on, what did we see Jesus doing during his life? I think that's a helpful guiding question. And so we have, Zana or Brian, did you want to respond to that, or should we move along?
I have nothing to add.
Okay.
Same here. I had nothing to add. I really appreciate the thoughts you shared. I resonated with them.
Thanks. So we have one question here that's pretty broad, but we have a few students who are looking to graduate soon. And this question comes as, what advice do you have for someone graduating with an MPH and just starting out looking for jobs and preparing to enter the workforce? And so we had a discussion before this with the panelists talking about how to communicate our value as young professionals, especially as you're interviewing and you're going up against people who maybe have been in the field for longer. How do you communicate that to others? And what other advice do you have for someone who's just graduating? Who would like to start on this question?
So I don't have an MPH, but I'm happy to answer the question.
Thanks, Brian. That's perfect.
So one of the things that I would just recommend is sort of know how to do an elevator pitch, like know how to talk about yourself and talk about your skills, and also be willing, like Katie mentioned, do the informational interviews, talk to as many people you can, and just be open with the job, like be willing to apply for a lot of different types of jobs, because you never know what'll click and what you really end up liking.
Thanks, Brian. Go ahead, Zana.
I was just going to add on that if you're still in university and approaching graduation, make the most of the resources that the school has as well. I remember there being a careers office that has staff who are willing to review statements, documents, practice with you as you prepare for interviews. The process of informational interviewing that Katie mentioned earlier, I think that's a university is a really good space to do that. Even if you're not looking for a job within academia, I think many professors undertake research projects in collaboration with implementing partners. So they may have connections or links to organizations that you're interested in. So do some digging on your faculty and their connections, and meet up with people, speak to them, let them know your interests, so that if an opportunity does come up, they have you in mind.
Thanks, Sana. Definitely second everything you said. And now's a good time to join all the listservs, because you never know what's going to come after you graduate. There's a lot of jobs that come up. And so that has been helpful for me, I know, and many of my peers and colleagues. Katie, did you have anything you want to add, or?
Mostly just to echo Brian and Zana, especially Zana, what Zana mentioned about taking advantage of resume writing workshops that your school might offer, or any of your networks that might offer, or friends and family. And I actually used all of the above when I was writing my resume and had it reviewed, I don't know, maybe like 15 or 20 times. But each set of eyes might offer something different, or even just fine tune a little bit of language. And as both panelists have said, you never know what is going to stand out to an HR department. And then also be willing to apply for things beyond the scope of what you think your dream job is, because there is definitely a such thing as a foot in the door. If it's an organization that you think you might want to work for, but it's not your dream job, you can take the job so that the organization will get to know you and get to know your skill set. And it's also an opportunity to try a new field of work for a little while you keep working towards your dream.
Thanks, Katie. Really good advice. So we have another question here that's kind of a big picture question. So it is, to my understanding, there's many organizations / groups which tackle global health from a technology and innovation angle, and others come from a policy, advocacy, communications angle. There's some overlap, but still a divide. Do you think it is feasible to combine the efforts more seamlessly? So that's kind of a broader question about, organizations specialize in one area or another. But I want to tie it into a question specifically for a young professional starting out. Public health is so broad. We see, a divide in groups and organizations that do one thing or another. Is it good at this stage to try to specialize and find your niche, or should you look at more broad organizations that do a lot and kind of get a lot of experience, maybe some more grassroots level or macro level, but looking at different, and what are the pros and cons of each, because people can do both or either and be successful. So who would like to start out with this question? It's a big one. I know you probably need a second to think, so go ahead, Zana.
Yeah. Yes, it's a big, going to the question, I'll start with the question that was submitted in the chat that's very broad and touching on this, and a very important question as well, touching on the fact that there's a lack sometimes in global health, many times a lack of speaking of siloed approaches to different issues, and if there's a way to have a more seamless combination of using technology and making sure that there's policy as well to support the uptake and governance of how that technology is implemented. Very big question, and I would say that I think an important step in finding a way to marry or make different organizations' efforts speak to each other a little bit better is around leadership and governance, and thinking about whichever space, context, country that this organization is working in, making sure that their efforts are very closely aligned with the government of that space. So if we're thinking about a country, the Ministry of Health, so the onus is on the Ministry of Health to have a clear strategy on what their plan is for their health system, and organizations to ensure as they are coming up with their technology, their innovations, their communication plans, their policy proposals, that those are aligned with what the country's own strategy is, so that they are supporting the public sector of that given space to achieve their goals. So I think it requires a lot of collaboration with the leadership in country, so the ministries of health, rather than coming in and telling people this is what we are doing. It's okay to have a proposal, but let the people in those communities contribute to that and speak to whether what you have as a plan, as an idea, as a global health institution, whether that meets their needs, whether that meets their people's needs. So I think that's one step towards having a more seamless integration of different efforts in the global health space. And the second question around, public health is so big. Are you going to go more niche? Are you going to explore several different options? I think as far as possible, as long as you can staying open, as Brian mentioned earlier, is a really good approach, and exploring, especially if you're new to the field. So when I was doing my MPH, this was my first step into public health, and I was very broad. I took epidemiology classes, biostatistics. I concentrated in health systems and policy. I did some health econ. So I was a little bit all over the place. That gave me a broad overview that skimmed the surface and gave me a taste of what public health is all about, and drew me to the conclusion that I want to learn more, which is why I'm now doing a doctor of public health. And so I think it really depends on the person, but regardless of what you choose to do, make sure that you're developing some skills along the way, as Kaity and Brian mentioned, hard skills, being able to write and being able to analyze data, if that's your interest and strength, will never, it will always come in handy at some point.
Thanks, Zana. That was a really good answer. Kaity or Brian, do you want to comment on this one?
Oh, Zana did give a great answer. My first thought when reading this question was, well, if you go to work for a government, you will find the intersection between technology and advocacy and policy. Technology because we need it, although you might find that depending on which type of government you work for, it might be a little lagging behind what like a independent private organization is able to work on. But Zana gave great answers about assessing what the leadership of an organization looks like, where their priorities are, where they're feeding into, to see if there is going to be a good married overlap between innovation, technology, policy, and advocacy. And then as to should you specialize or stay open, I'm someone who likes to try a lot of things and I feel like my bio reflects that. And it's taken me even up until current era to get an idea of how to narrow my career and specialize even now. So same thing, be open to taking classes, especially while you have the benefit of being a student and your job is to learn. If you have room in your schedule to try a course that it sounds interesting and you don't know a lot about, I would always say go for it.
Great advice, Kaity. Brian?
Sure. So also fantastic responses from both my fellow panelists. Back to the original question, I just also want to highlight, this may be a microcosm of the DMV, but within the international development and global health space in Washington, there are a lot of really good advocacy organizations. CCIH is one, Interaction, Society for International Development. So there are these membership organizations that bring organizations together who focus on advocacy, technology, the different points touched on in the question, and our work to help unite them, get them to talk to each other, sort of share ideas and develop common messaging. So that is going on as we speak even. Also echoing Kaity and Zana, I would also recommend sort of going broad and being open to large organizations, because those really help you figure out what you want to do and try a lot of different things. I know in my experience, my organization is a big organization in terms of the sectors it works in, and that's given me the opportunity to expand my knowledge about more than just global health, and I found that really valuable.
Thanks so much, Brian. I know in my life too, in my short public health experience, I spent a couple of years researching road safety. And although it's an important topic, I'm not so passionate about it. But the skills I learned helped me for everything else and helped me figure out what I like and what I don't like and what areas I'm interested in. So I think there's so many benefits to also, using this time and this period to look at a lot of different things and pull from your interest and learn more about yourself. This question probably would be good for Katie, but the other panelists are welcome to answer as well. But it's, as someone who wants to go into the field of global health after college, do you have any suggestions in terms of the kinds of experience that I should try to get under my belt? I've been considering volunteering in the Peace Corps, but I'm unsure whether it's better to do that before or after getting a master's degree. And you're in luck because you have two people, and one did their Peace Corps experience before their master's degree, and that's Katie, and I did my experience Peace Corps after master's. I think there's benefits to both, and you can definitely, Peace Corps really is what you make it. I mean, it's a really open experience where you can take a lot of initiative. So for me, I tried to tailor the projects that I was working on, pair it with my community interests and what they were working on with what, I had recently learned in my master's degree. And we were able to do some really cool technical projects and build some curriculum around health education in my community. And that was really helpful. And I didn't necessarily have those skills before I joined, but I know my experience would have been just as valuable if I had done it after my bachelor's as well. So Katie, do you want to describe, how you felt like coming in after your bachelor's and before your master's was valuable to you?
Yeah, I also had a couple friends who, Peace Corps friends, who came into Peace Corps after their master's, and a few friends who knew what they wanted to study, but still did their Peace Corps service before their master's and went to master's right afterwards. And then there was a few people like me who were still shaping what they wanted to study. So I don't think I could have pursued a master's right out of my undergraduate. I really needed some work experience to find out what my skill sets were, where my passions were, and where I wanted to develop further. And my Peace Corps service ended up being integral to that process of being able to work closely with a community. Like I said, I wanted to live in another country, and so I was able to live not only in another country, but truly in a community where I was not only the only American, I was the only foreigner at all. So got to develop my language skills as well. So if it's a question of you're still exploring what you might want to study, I would say Peace Corps service first, because you'll get 2 years to explore and work on a variety. You'll have your primary service, your primary assignment of what you're doing through the Peace Corps, but you're going to do a lot of other things with your community as well. So, and then any other volunteer opportunities you can do. And there is organizations that you can do here in the United States if you want to get a taste of what global health is like from a US context. So when I was in graduate school, I actually volunteered with a free clinic that served almost entirely people from other countries. And that was also seeing global health working inside of the US system as well. So any volunteer opportunities and a varied volunteer experience, I think, will serve you well.
Thanks so much, Katie. I know we have about 10 minutes left. So I'm looking at there's a few questions left, but I think we just have time for one more. So there's a question that's kind of looking at, public health isn't the highest paying field. We all know that. And how you balance your calling with your finances, and especially as a young professional, how would you go about interviews knowing, what type of salary expectations you should be having, what those conversations will look like? This can be an uncomfortable topic, but especially as people just starting out, we need to band together and utilize your network to discuss these things, so you are have a good understanding when you are having these conversations with future employers. And so to any of the panelists, how did you do that for yourself, and what recommendations would you have for others that are starting out?
I could take a stab at this at least. So I think the key piece of advice is sort of research ahead of time before you're going to the field what the general salary expectations are, so you sort of have an understanding as you're applying for jobs what you may be earning, and also know what you need to survive. Like at the end of the day, if you're passionate about something but you're not gonna be able to pay rent and eat, like you have to be able to take care of yourself first, because you can pour from an empty cup. So sort of know what you need to survive and then go from there. Yeah.
Thanks, Brian. Really sound advice. Kaity or Zana?
Brian touched on that our professional lives are not our entire lives. So absolutely, you're going to have to look at the entire picture of what you envision in your life. What are things that you feel like you must have in terms of like where you want to live, what the average cost of rent is. Are you willing to live with a few people to make rent if the job that you're taking doesn't pay as much? So yeah, being realistic about what it costs to live. You won't stay in that place forever, but also going back to the informational interviews, don't be shy about asking people what their salary is and what their salary was at different points in their career, because they were young as well once and they had to go through the same process, so that you are just equipped with the best information you can be.
Thanks, Kaity. Zana, do you have anything to add?
I agree with everything my fellow panelists have shared. Just one small addition is speaking to your peers as well, people at a similar level to you in their career. I think speaking to mentors or people who have gone ahead of you in informational interviews is really important, and also speaking to people who are currently navigating the same workforce that you're navigating, because as we know, as times go, things change. So being transparent with each other about how much we're getting paid, and just to gauge whether you're selling yourself short, whether this is not the best opportunity for you, that kind of thing.
Thanks so much, Zana. And to your point about, finding good mentors and the wisdom that they can bring. I know I've been so grateful for the mentors that I've had, and that can be so helpful to have these honest conversations. So we have about 5 minutes left, so we should start to wrap up. I wanted to just highlight that there are, as you're looking for jobs and opportunities, CCIH has some and shares some positions and internship openings, and there'll be more in the coming months. So you're welcome to look on CCIH's website for those. We would love to hear just one piece of feedback, one sentence, one line. And so there's a link to that feedback portion in the chat as well. We hope you enjoyed this session. I think it was even valuable for me to hear from the panelists again, but as young professionals starting out, it's so important that we talk to each other and support each other, network with each other, so that, we have people that we can share our experience with, but also hear from, learn from, grow from, and really understand our collective value as young people starting out in this field. And so thanks so much for joining. Again, a recording to the webinar will be sent out to all the registrants, and you're welcome to also find that on our YouTube channel or website. And Zana, if you wouldn't mind closing us in prayer, that would be great.
Sure. Thanks, Carolyn. Let's pray. Lord, we thank you for this day. We thank you for this opportunity to share and to learn from each other's experiences. Thank you for everyone who is able to dial in today. We pray that everybody will take away something useful for them as they navigate whatever stage they're at in their career. We thank you so much for the gifts, the resources, the capabilities that you have equipped us all with as we advance your kingdom in this world, as we engage in this global health field. Lord, we pray that all our efforts will bear good fruit, and we trust that you will continue to guide us as we make the decisions about our careers moving forward. In your mighty name we pray. Amen.
Amen. Thanks so much, Zana. Thanks everyone for joining. Just a quick plug, the CCIH annual conference is coming up in May. If you haven't registered, registration's open and can be found on CCIH's website. And thanks again for joining, and a huge round of applause to our panelists. You did a wonderful job. Thanks for your wisdom and for sharing that with us. Bye, everyone.
Thank you. Thank you for moderating. You did an amazing job.
Yes, thank you, Carolyn.
Thank you.
Thank you, everyone.